Okay, so we're going to make a start. Hopefully everybody that's going to join us is here. So welcome everybody. Thank you very much for coming along this afternoon to our webinar where we're going to be talking about COVID-19 and the vaccine. So this webinar is for people with learning disabilities and people with autism, and it's also open to the people that support them as well. So we're going to be talking about people who live in 4 boroughs. So that's Barking and Dagenham, Havering, Redbridge and Waltham Forest. So if you don't live in one of those boroughs, you're still very welcome to stay and listen, but just do bear in mind some things are slightly different in different boroughs. So we are mostly going to be talking about those 4. So this is a Zoom meeting. Hopefully some of you will have had a Zoom meeting before, so you know the setup, but this one is being run in what we call webinar mode. So what that means is you might not see a mute button or a video button, but don't worry, nobody can see you, nobody can hear you. It's just us in the panel that can. So don't worry about going on mute or anything like that. So the format today is we're going to be doing a presentation for you all, and then we're going to be focusing on some questions. So with the invitation, you will have seen there was a link to send your questions in for the panel. So we'll be doing some of those at the end of the session. If you look at the bottom of your screen, there is a little button there which says Q&A with 2 speech bubbles on it. So if you have a question that doesn't come up today that you'd like to ask the panel, please feel free to write that in there and we will try and get to that today if we have time. Only the panel will be able to see your question, nobody else will. I can see, Roger, you've asked, saying the presentation had better be an easy read. I promise you it is. I've done it myself, so it's fully easy read, don't worry. So if you have a question today, what we're going to do is after this session, we're going to write up all your questions and we're going to publish the answers to those. So you'll get the link to that the same way as you've got the invite. And that document will also be an easy read so that that can be shared and people can have a look at it. What we will ask with your questions, because this is a public meeting and everyone's going to be able to see it, we ask that you don't share any personal information in your questions because it will mean that we can't answer them today. But if you do have a personal question about yourself or somebody that you support, Annie from our comms team is going to put an email address now in the chat box. So if you have a personal question, you can email that link and one of us will have a look and get back to you. But make sure you don't pop it in the Q&A because we won't be able to answer it in the session today. So if we can get the presentation up, if that's okay. Lovely, thank you very much indeed. So if we could go on to the next slide. Thank you very much. So today what we're going to be talking about is, first of all, we're going to talk about what is COVID-19, and we're going to be talking about what is the COVID-19 vaccine. We're going to be talking to everybody about what will happen when you go in to get your vaccine, why the vaccine is important, and what extra support can you get if you need it. So if you need extra support to be able to go and get your vaccine, what are we able to do for you? So we're going to talk a bit about that today. And we're also going to be talking about something called Mythbusters. So some of you might have heard a lot of questions about the vaccine. You might have heard some rumours. You might have heard some things you're not very sure about. So we've got a list of questions today that we're going to go through and we're going to give you the answers to those today. So if I could have the next slide. So I'm just going to introduce our panel. So first of all, we've got Dr. Jyoti Sood. Dr. Sood, I don't know if you can say a quick line about what you do.
So, hello there. I'm the clinical lead, which essentially means I'm the doctor that helps other doctors and nurses look after patients with learning disabilities and autism in the BHR area.
Lovely, thank you very much. And then we have Rizwana, if you want to do the same, Rizwana.
Hello everyone, my name is Rizwana and I'm a pharmacist. So I have been working with patients who need a bit of extra support in getting their vaccine to them safely. So I've been doing some home visits and I've been coming out and making sure that you're comfortable and you're able to have the vaccine done in a safe and effective way.
Thank you very much. And then you've got me. So my name's Rachel Penny, and I'm what's called a strategic lead. So I work across all 7 North East London boroughs, making sure that we have good plans in place to support people with learning disabilities and autism. And I'm going to be facilitating this session for you all today. So if we could go on to the next slide. And I think Dr. Sood, you're going to start the presentation for us.
Thank you ever so much, Rachel. And I, again, a warm welcome to everyone that's there. Really pleased to see the interest this webinar has generated. So I'm going to start talking with the basic question, actually, what is COVID-19? So I'm sure you've all heard about this the last 18 months or so, but just a bit of a recap. So COVID-19, which is also called coronavirus, is a new type of virus. And you will see on your left, that's the structure of a virus. Next bit, what symptoms can this cause? It can make you feel quite poorly, and I'm sure you know this, but just to recap, it can cause a temperature, make you feel quite tired, it can make your breathing harder, it can make you cough. Some people also report that they lose the sense of taste and smell. Now, the good thing is that most people who have had the COVID-19 get better at home. However, some people have to go to the hospital to get better, and unfortunately, some people have died from COVID-19. Next slide, please. Now, this is a really important slide. It tells you people that are more likely to get ill. And these are people that have diabetes, people that have liver or kidney problems. And again, on the left, you would see the structures of the kidney, people that have a heart problem, and people that have had problem with their breathing, like asthma or COPD. Next slide, please. However, I'm sure you all know the really fantastic news is that we have led the way in UK and we have the vaccine. Next slide, please. So what exactly is a vaccine? So a vaccine is an injection which is given by a nurse or a doctor, or it could be given by anybody else who's had the right training. It would stop you getting COVID-19 or the coronavirus infection. It also helps stop the virus from spreading from different people. And that means that if you get the vaccine, you should feel less poorly. Next slide, please. So what happens? So I'm just going to talk a bit about what happens when you get the vaccine. So there's 2 injections. The first one will be given at your first appointment. The second one, 12 weeks later, at another appointment. That's usually done on your upper arm. It could be either side of the arm, and you'll feel a tiny scratch. The nurse or the doctor or whoever's actually injected you may put a little plaster on after. Next slide, please. So, like with anything, you can get some side effects. At the site of the injection, your arm can feel a bit sore or may hurt for a few days. You might get a bit of a headache and feel poorly for a few days, or you might be absolutely fine. However, if you do feel unwell, do let somebody know, and you can take pain relief like paracetamol if required to help manage the symptoms. Next slide, please. So why is the vaccine really, really important? We all know how hard it has been in the lockdown and the things that we really miss, like meeting our friends and family, or going out shopping to our restaurants or to cinema, and just going out essentially is completely stopped. So if everybody gets the vaccine, we can get back to our normal lives quite quickly and meet our friends and family and enjoy the things we normally enjoy in our life. Next slide, please. So this is the bit that Rachel was talking about, needing more support. So the support can be in different areas. So if you feel you need more support in reading and understanding more about the vaccine, there are easy read information. You could let the people or the centers know where you're going for your vaccine that you require a quiet waiting area or a longer appointment. And make sure that you let the GP practice or the center know the support that you would need that would help you get the vaccine. There may be support available from the practice or from your community learning disability team, and also from Rizwana, in our case, luckily in BHR, that can help you get the vaccine. But make sure you let us know that. Next slide, please. Now, this is an area people would really be scared of needles. And this is an area where we can really help you. So when you arrive at your vaccine center, make sure you let people know that you are worried and that you're anxious and you're scared to get the vaccine. They can use some techniques to distract you, to make you feel better, give you more time, and understand what your needs are in order to get the vaccine. However, if you're really worried, you could speak to your community team or a social worker. They can get you help from the community team in a technique known as desensitization. That means somebody would help you and work with you to get used to having injections. And that's not just relevant for COVID, but also for other injections like flu, etc. Next slide, please. Now, I'm going to hand over to Rizwana to sort out some of those Mythbusters. Rizwana, thank you.
Thank you, Dr. Sood. Okay, so I am now going to talk a bit about the questions that might be circulating around about the vaccine and maybe just clarify any uncertainty that people might have regarding this. So people do say a lot of things about the vaccine, and we're going to go through some questions that people have asked about it and what the answers are. Next slide, please. So a lot of people think, will the vaccine give me COVID-19? Next slide. Answer, no. The vaccine will not give you COVID-19. Having the vaccine makes it much less likely that you will be seriously ill in the future. Now, a lot of people do think that the reason why the vaccine might give us COVID-19 is because it is made from the actual virus. However, it is important to understand that it is not the virus that is going into our body. It is a different form of the virus. So it can't cause the virus itself, but it's going to help us to fight it if we were to get it. Next slide, please. How can the vaccine be safe when it was made so quickly? So we were able to make the vaccine quickly because everyone was working very hard and working together, and lots of money was given to help support that. So the COVID-19 vaccine was accelerated in terms of its production, but it has been through the same checks as every other vaccine has been. So it's no different to any other vaccine that has been given to other people, and it works in exactly the same way. Next slide, please. Is one type of vaccine better than the other? So there are two types of vaccines that are currently in the UK at the moment. One is called the Pfizer vaccine, and the other one was made within England, and it is called the AstraZeneca vaccine. Both vaccines are very similar in terms of protection, and both vaccines will offer extra protection to the COVID-19 virus, and we should be grateful for whichever vaccine is offered to us and take that one. Next slide, please. Will the vaccine work against the new types of COVID-19 that have been on the news? So we expect the vaccine to work against the different types of COVID-19 that we have heard about in the news, but we will keep checking. So most viruses change over time, and it is important to stop the spread of COVID-19, so this is less likely to happen. And it is also important to understand that although there are different forms of COVID-19, the vaccine will be effective on all these type of forms. They might be more effective on one of the first forms that was out there because this is where the trials were done, but that doesn't mean to say it won't be effective on the new types of strains that are now around. Next slide, please. Do I still need to get the vaccine if I have already had COVID-19? Yes, definitely. You should still have the vaccine. We don't know how long people are protected for after being ill with COVID-19. So it is very important that we get the vaccine so that it makes it less likely to get COVID-19 for a second time. Next slide, please. Is the vaccine safe for me if I have allergies? So there's a very small chance that you will get a reaction from the vaccine. And for most people, it is safer to have the vaccine than to risk catching COVID-19. So if you do have any allergies and you are concerned, then you are able to speak with your doctor or the person that is giving you the vaccine, and they will let you know if the vaccine is still safe to have. Could having the vaccine mean I cannot have children? The COVID-19 vaccine has not yet been tested on pregnant women, but there is no reason to think that it would harm your chances of having a baby in the future. Next slide, please. When I have my second vaccine, can I stop wearing my mask? After your second vaccine, it is less likely that you will get ill, but it does not mean that everyone will have had the vaccine yet. So it is important that you do continue to wear your mask until everybody is safe. Next slide, please. That's the end of the Mythbusters. So if there are any questions, we will be happy to answer them now.
Thank you both. That was really helpful. So what we're going to do is we've had some questions that were sent in before the event that I'm going to put to you both, and then I'm going to have a look at the Q&A box. So we've had a couple of people join us throughout the presentation. So if you weren't there at the beginning, if you've got any questions at all about the presentation or anything else you want to ask, there should be a little box at the bottom of your screen with the letters Q&A and 2 speech bubbles. So write your question in there and then we will put it to the panel. Nobody else can see your question, only we can, so don't worry about that. So one of the first questions we had in is, can our son's vaccination be given at home? Who wants to answer that one?
Shall I go for it, Jyoti, or do you want to? Okay, so when the vaccine programme first began, we looked at the ways in which we can support our patients who can't go to the mainstream services, who can't go to the GP or go to the mass sites. And through that, we developed a pathway that allows us to facilitate home visits. So yes, if for any reason, Rachel, was it a parent asking about their child?
Yes, so this one was a parent asking about their child, but it may well be there are other people with similar who are
absolutely. So if you're a parent and a carer of a patient who needs to have the vaccine done at home, the short answer is yes, we can come to you, and I have done a lot so far, and they've all been very successful. So yeah.
Lovely, thank you.
Rachel, if I may just add, I think in terms of the route of access, it could be via the GP and also the community team. So if you could contact your GP, they should be able to signpost you to the pathway or refer your son onwards to Rizwana's team.
Yeah, thank you. I think that's really important, because people might have seen there are lots of different ways to get the vaccine, and you might get your offer from lots of different places. So if you have something that you need to be done, like a home visit, it is really helpful to speak to your GP so that your GP knows that that's what you need. And all of our GPs know how to get in contact with Rizwana and her team, so they will be able to help you with that. So the next question we've had, this is another parent, and they've said that their son, they think he might find having the vaccine difficult, and they're concerned that he may hurt himself or others nearby when he gets very, very anxious. And they've asked, is it possible for him to have the single dose vaccine so that he has to go through it only one time?
So, Rachel, I can say that. So at the moment, the evidence is that you require two doses. If you have one vaccine, it still covers you, absolutely, but it won't be as effective as with the second one. But it's something that the parents would need to weigh, and again, with the support of their GP, as to the risks and the benefits of that. So if they feel that it is more risky to have a second injection because of the risk to the child, then that's the point of discussion with the GP. However, in terms of the evidence is clear that you require 2 vaccines to have a better cover.
Lovely, thank you very much. So I hope that's answered that one. Someone has asked, this is another one from a parent. They said, my son is 21 years old, and they are concerned about how they can support him to get the vaccine because he hates the sight of needles and does not allow people to inject him. And I think that's something we see quite a lot, and it's not just people with learning disabilities and autism. Lots of people are very, very frightened of needles. So they've sort of said he's quite powerfully built, and they're worried that if somebody comes towards him with a needle, he will push them away and refuse to have the vaccine. So can either of you talk a little bit about, in a bit more detail, about what we can do for people who are scared of needles?
Yeah, I can go for this one. Yeah, so we have done lots and lots of visits for those patients who have very similar presentation to what you've just described, Rachel. And the key is we don't let the patient see the needle at all. And whenever I schedule appointments in, we communicate with the carers or the parents or whoever's going to be there with the nurse that's going to come with me, and we have a plan in place. So we will find out the extent as to what the phobia is. So is it the fact that they can't see the needle at all? They don't want to see any kind of medical equipment. We even take off our badges. We know we've come for a check. We'll just find out what will work best for the patient, and we'll have a plan in place to make sure that we make the patient as comfortable as possible. So these techniques have been playing a computer game on the iPad, having two carers on either side of the patient, making them listen to music or just looking away. We've had patients sitting on a beanbag so that it's a bit more difficult to get up. So if I do kind of come from behind and vaccinate, some haven't even noticed when I'm vaccinated because it's such a small scratch and it's over in less than a second. It can be done really quickly, and as long as the patient doesn't see it and they're distracted, it can be done successfully. Another technique we've used is asking patient if they want to have their blood pressure done. So because that doesn't involve a needle, it gives us access to the arm. So they're able to give us their arm, and at the same time, we kind of quickly vaccinate. And again, they haven't even noticed. So it's just important to get all the information gathered from the parents and to find out what's going to work best for them. We had one patient who she wanted to have the vaccine and she knew that she had to have it, but she had a very severe case of needle phobia. So she said, "Can I wear a blindfold?" So she wore a blindfold, so she didn't know when the needle was coming. But she wanted it, and she didn't even feel it as well. So different techniques work for different people. So for that specific situation, we would ask what's needed and we would make those reasonable adjustments to make it happen. And so far, they have all been successful, touch wood. So I am very confident that we can make it work regardless of what the level of the phobia is.
And Rizwana, if I can just add, the community nurses, learning disability nurses, are really keen to support patients, not just for COVID, but as I said in my presentation as well, for other vaccines that they may need to try and help them desensitize. So it's just a technique that they will use to try and get over the fear of needles. So it's an opportunity I think parents should embark on, and even if it's for COVID now, but ongoing support with any other vaccinations. That would be really helpful. And I know centres that have actually gone out into the car park as well to do the vaccines because patients didn't want to come into a busy sort of building, which is completely understandable. But that's the importance of letting the centre or the clinician or wherever you're getting it, them know about the reasonable adjustment to be made.
Thank you both. So that's quite an in-depth answer. I think the key message is if you have needle phobia, if you're scared of needles, or if you're working with somebody or living with somebody who's scared of needles, the best thing to do is to talk to your GP and talk to your community team, and they will be able to come up with the best way of helping you cope with it, because everybody's very different. Some people, like Rizwana said, might just not want to know that it's happening. Other people might need to know exactly what is going to happen and when. Other people, it might be a little bit more of a do it from behind, don't talk to me about it, let's just come up with a plan together. So I think everybody is very different in what they will need, but as Rizwana said, the team will work around the best way of doing it for you, and we'll come up with a plan together to kind of help you get your vaccine. I think, as Dr. Sood said as well, it's really, really useful for the future, because hopefully COVID-19 won't be here forever, certainly not as much as it is now, but in the future we may need flu vaccines, we may need to have blood tests lots of different things that need needles. So to kind of do some work now, I think bodes really well in the future. So do speak out if that's something that you think we can help you with. So I'll go on to the next question. I think we've had all the ones that we were asked before, so I'm going to go into the chat box now. So the first question we've had, so this one says, where are these to access them? So I think that might have been about some of the things that you were talking about in your presentation about the different types of support. So perhaps if you can talk perhaps about who somebody should speak to if they need more support to get their vaccine. We've already talked about it a little bit, but where can they go or who can they ask for advice?
Rizwana, do you want to take that one? Would you like me to, or we can do a double act there?
Yeah, we can do a double act. You go first.
No, as I said, I think your first port of call would be your GP. The pathway that Rizwana has kindly designed for referral, which means if the GP practice finds it difficult to make adjustments or is not clear on how to help get the patient the vaccine, then the patients can be referred to Rizwana's team to get the vaccine. So that is a really straightforward process. Equally, you could speak to your social worker. You could also speak to your community learning disability nurses if you're known to them. So there's various routes really into this. But the really good thing was the excellent work. I think Rizwana, it was fantastic. I mean, I would pride myself in looking after our patients at our practice with learning disabilities and making every adjustments we could. But even we found, 4 or 5 patients required that extra level of support that we had to then refer to Rizwana's team. Rizwana, do you want to add something else?
Yeah, so as Dr. Sood has said, the pathway allows referrals and that can come from anyone. So it could be GPs, could be parents, could be carers, social workers, and they will let us know that the vaccine was unable to happen through the normal services. And because of that extra support that's required. So we will then identify what that extra support is. Is it a home visit? Is it that the patient needs to be a bit more relaxed? Is it distraction techniques that are needed? We will then confirm all that. We will put a plan in place. We will schedule the appointment in, and then myself, along with the nurses, will come out and do the home visit, and hopefully the vaccination will be successful. It's as simple as that.
That's great. Thank you very much. So I've got a question saying, my son is scared of needles, so what are our options? So I think we've answered that one already, which is really, really good. And I know that is something that a lot of people are dealing with at the moment. So we have a comment, I suppose, that perhaps actually one of you may be able to reflect on. I think this is relating to the earlier question about having 1 dose rather than 2. And the question is, the Johnson & Johnson vaccine is a single dose, but they don't know when it's coming to this country. So that's more of a comment, but I don't know if either of you have got some thoughts on that.
No, I don't think we have the timeline yet. Nothing from the government. I think that's a question we might have to put to Boris. But we definitely don't know the timelines for that. But you are right, it is a single dose vaccine. The early trials are quite promising in terms of the efficacy, i.e. how effective that would be. But that's all we know at the moment. Rizwan, I don't know whether you've got any other.
Yeah, no, same. We haven't been given any information as to when we will get that vaccine and if we will get that vaccine. The only vaccine we have currently within NELFT is the AstraZeneca vaccine. So I think that's quite important to share and confirm too.
Lovely, thank you very much. So I think the message as it stands is bearing in mind that what we have at the moment is a 2-dose system. The earlier answer that the panel gave applies, is that to get the best protection right now, you do need to have those 2 doses. But hopefully as people learn more and develop more, we may have an option in the future for a single dose or a single booster. But for now, the message is to get the double dose if you can, to make sure that you have the best protection that you can get. So our next question is, we've been asked, will siblings of children with SEN be pushed to get their vaccine along with their siblings? that might be a political question rather than a one that you're able to answer. If you've got any thoughts on them, please share, but it might not be one we know right now.
Yeah, I think it's a difficult one because I think we've been told quite strictly to follow certain cohorts, and we actually get pulled up if we don't follow that. So it's a hard one. However, I know some practices and some centres, and if they've got sort of surplus vaccine at the end of the day, they would be quite happy to vaccinate the families or members that are attending with the children, or the other way around. So I think there is a bit of flexibility, but it is something that we are not encouraged to do. So definitely another one for Boris, I think. And I completely agree. Actually, I think that when the cohorts came out, I was extremely surprised not even to see sort of mild and moderate LD, in that. So very, very disappointed. And Rachel and I made quite a few. Yeah, we had quite yeah, exactly. We made our thoughts really clear to the powers to be, but it's not a decision that we've made. But at the moment now, I mean, LD definitely is covered, so which is a great thing.
I think we are covered to vaccinate those who act as carers for the patient in question. So a couple of visits I've done at home, I've had vaccinated parents, or if it's staff of a home, then they've been able to do it at the same time. So if the sibling was to act as a carer in some capacity, then that might be a doable option. Yeah.
I think that's a good point. I think it's unfortunately not something that we can answer directly today, but I would probably say that if you are in that circumstance, I would encourage you to have a conversation when you're offered the vaccine, or when the person you're supported is offered that vaccine, about the family members in the house, and what people think is the best way to manage that. As Rizwana says, carers are entitled to the vaccine, so if you're caring for somebody, you should get that vaccine as well. With siblings, we may not be able to do it directly, but I will say that we are continuing to change and learn and revise the guidance at a national level. So as Dr. Sood says, when this started, everybody with a learning disability wasn't initially included, and in February that did change because it was recognised that absolutely they should be. So it may well be, as time goes by, that guidance does get refined, but for now it is a case that it's not a group that we can explicitly cover, but do have a conversation if it's something that you are concerned about.
And Rachel, if I can just add that it's really important that if you are a carer, to get yourself registered under the GP practice in your notes that you are a carer, because often we wouldn't know. And when we do offer to carers, we rely on the practice lists. And if there is a recording that you are a carer, then you'd be on that list, otherwise not. So it's really important that if you feel that you are providing the care, then make sure that it's in your GP records.
Absolutely, thank you. That is a really, really good point, and I would reiterate that is that our GP records are the only way at the moment that we have to uniformly make sure that everybody has that. So absolutely, please do make sure that you are registered. There's I know Barking and Dagenham had a learning disability day not very long ago, where they actually vaccinated sort of people with a learning disability and their carers together, so that it was one trip. You could get it done with kind of, a bit of support for each other at the same time. So we are really, really keen that those who are caring for people with learning disabilities and autism do take that offer up. So absolutely, please do get yourself registered with the GP as a carer if you're not already. Thank you very much. So we've got a question saying, is it easy to access the Easy Read leaflets? Now that's a good question. I don't know if either of you want to pick that one up.
They are definitely available on Public Health England website. Jyoti, I don't know if the GPs are doing anything to get it sent to patients.
No, so we've just got the Public Health England link that we would send out that can open up. Again, that's because of the reduced footfall in practices. So, but that's a really good point, and I think perhaps, Rachel, we need to support that within our either NEL-wide or some sort of a platform. But that's thank you for that. I think we need to make sure that consistency across the PCNs and practices is followed. But when you get to read the leaflet, it's very easy read, yes.
So I think it's one of those things where there's lots and lots and lots of easy read information out there, but if you don't love using computers, which not everybody does, it's not that easy. So one of the things that we're going to do after this session is, like I said, we're going to send round a link so that you have the question and answer sessions, and we'll also include in that some of the easy reads that find online, so that you'll have those links and you'll know where to look. So MenCap, for example, have lots of really, really good ones. There's some ones the government has done, so there is a lot out there. So we will send those links so everybody has them in one place. We do need to think a bit more, I think, about people that can't use their computer. So what we're going to be doing across North East London is we've agreed that we're all going to do an easy read letter that we're going to post out to people who are with our community learning disability teams, so that everyone's got a letter, and we'll also work with our doctors' surgeries as well to make sure that they have copies of that letter as well. So if they've got any patients who haven't had their vaccine yet, they can send it out. We have, I think it is worth saying, we have managed to vaccinate a lot of people with learning disabilities, so I think more than half. And that was a couple of weeks ago, and things are going really quickly. So we know that quite a lot, over half, I think is closer to 2/3 now, have had their vaccine. So we are making lots of progress. But I think what we need to think about now is making sure that perhaps people that don't know as much about the vaccine, or who may not have had their offer, we make sure that they have absolutely all the information they need to make the right decision. So thank you very much for that question. And we will think about what more we can do to support people with that.
And Rachel, if I can just add that actually most of the primary care networks, which is the GP practices that have come together to work together, they've now got access to social prescribers or link workers. And I know in certain parts, they've done really well trying to tackle what we call as vaccine hesitancy. That means people that are reluctant or not sure if they want the vaccine. So they've got plenty of information and they can work with you. So they're called social prescriber link workers. And please check with your practices if they've got one that can then talk you through about any other queries or concerns you may have about the vaccine.
That's really helpful. Thank you very much. So we have a couple of comments on that, which is really useful. So somebody has said in Waltham Forest, the GP has already been given the easy read. So that's really good. So in Waltham Forest, they're ahead of the game. So we'll make sure that we catch up with that in Barking and Dagenham, Havering and Redbridge as well. And there's also a suggestion that perhaps NELFT, so NELFT is our community teams who work across the boroughs. There's a suggestion that perhaps we can put it on that website, which I think is a really good idea, because sometimes when people are looking for information, they don't always think to look at, because I'm from the CCG, which is the Clinical Commissioning Group, and often people don't know what that is. So if you're having a look online, you may not think to find it there. So I think that's a really good idea, and perhaps we can think about getting it on that website as well. That would be really, really helpful. So that is the end of my Q&A box, but I have noticed that some people have put some other things in the chat, so I'm going to have a look at that one. So I have a question here. What are we supposed to do if services reopen and clients attend who have not had a vaccination when their parents have refused? It is putting our loved ones at risk if they return to services that allow unvaccinated clients in. So I don't know if either of you have any thoughts on that one.
So yeah, we have had a few situations where parents are hesitant and for whatever reasons in the past, they're not happy to have their children vaccinated. So we've had meetings and we've given as much supporting information as possible to try and get them to change their mind and realise that it is in the patient's best interest decision to have the vaccine done. But you know, you still get some parents who are still quite resistant. So we just give them a bit of time, not push them, but maybe give them a little nudge. So I'll say, you take the information away, you take as long as you can to read it, and maybe catch up again in 2 to 3 weeks' time and see if they have changed their mind. I think it's just important to keep that contact in place and to let them know that we are there to answer any questions that they might have and give them the support that they have regarding their hesitancies, and hopefully help them to change their mind in the long term. But saying that, we have had some patients, parents who have refused, and I guess there's nothing really we can do in that situation. So a bit of support in that might be helpful. I don't know. We haven't really taken it further as of yet, but that is where we are currently. We're just trying to reassure as much as possible and let them know that we are at the other end of a phone call if needed. And if we don't hear from them in 2 to 3 weeks, I will give them a call myself just to ask where they're at and if they've changed their mind. A lot of parents have said they're not saying no, but they're saying not right now. So in that situation, I have kind of emphasized the urgency into, you know, the LD patients were in cohort 6 and we've kind of moved on since then. So it is important to get them done as soon as possible because of their vulnerability, etc. So we have had a few situations like that, but it's just a case of just making sure that they're not forgotten about and that we do call them and we do keep that contact with them to let them know that whenever they do decide and that they are ready, we are able to support them with whatever they need.
Thanks, Rizwana. I just have to say that I think the vaccine's absolutely brilliant, but you've just got to remember that you still have to follow the social distancing and the masks and everything to reduce that risk anyway. So that bit carries on, and absolutely similar issues at general practice level as well. But the footfall is high, but you still have to follow those measures that have been put into place. So hopefully that would, to an extent, reduce that risk, and obviously get yourself vaccinated. That's important as well.
Thank you both. I think that is quite a tricky one because obviously we're not in a position where we can make somebody have the vaccine. But when people are making decisions on somebody else's behalf, we do have to look at it as a group and we need to think about, is that in the best interest of the patient? So as Rizwana says, I think it's about when somebody has said no, we do need to keep coming back to that conversation. And I think at the moment we are still in lockdown. I know that on Monday we did have a little bit of freedom. We can now sit outside with people, which is lovely. But I think that, you know, a lot of people are still staying home a lot of the time. So I think the not now question, as Rizwana said, if somebody is usually at day services, it may be that prior to them going back to day services, they may change their mind, because at the moment a lot of people are at home around the clock, and the idea of getting a vaccine is really quite scary. But if the idea is that you're about to go back to your day centre when there are lots of people about, even if you are social distancing properly, it may be that at that point they're more willing to have a chat with people like Rizwana and their team and the doctors and say, actually now might be the time that we think this would be a good idea. So the main point is that the door doesn't close. We do keep going back to them and we do keep talking about the risks of not having it and the benefits of having it, so that people could continue to change their mind if they want to. So I have a couple more comments. Annie has said that we have a patient and stakeholder update. So that is an email that we send out to all of our patients with information about what's happening. And in the last one of those, there was some information in there. And she has put an email address, so if anybody wants to go onto that mailing list so that you get that information sent to you, make sure that you send your email address to that email address in the chat and they will add you onto that list. And she's also put a link there to our page where some of the easy read documents can be found, and we'll share that again after the event. So we have a comment here as well, another one about Waltham Forest. So this is saying that there is a vaccination centre in Waltham Forest at the Walthamstow Library, and they've got a quiet room there, so to let the receptionist know when you arrive. So most of our vaccination centres have some sort of reasonable adjustment. So if you need a quiet room or something like that afterwards, just to calm down, or before, make sure you tell the receptionist when you arrive that you need that and they can sort that out for you. So we've got a couple of people who are asking to be added onto the mailing list, which is good. And I think I've got a couple more in the Q&A, so just bear with me. Okay, so this is another one about Waltham Forest. So they're saying Waltham Forest is planning on having a learning disability special vaccine clinic. So I think that's similar to the one that I mentioned earlier that Barking and Dagenham did, which is a kind of special session for people with learning disabilities that they're going to offer. So they're saying that they will do that at the Community Learning Disability Base in Walthamstow, and that the London Borough of Waltham Forest and the NHS will make sure that that's communicated so that everybody knows the date and when to go along for that. So hopefully that'll be helpful if you live live in Waltham Forest and you'd like to get the vaccine on a quieter day when people are ready to do that. So people are using different Q&A and chat boxes. So sorry, I'm jumping between the two if it looks like my eyes keep moving back and forward. So somebody's asked, why can't Redbridge do that? I presume that means having the dedicated day for people with learning disabilities and autism. I don't see why they can't. It might be that we talk to whoever's organised the others about it. I don't know if the panel has a comment on that at all.
No, but I think it obviously it's clear that in Barking and Dagenham and Waltham Forest it's working. So it's just something that we can ask. Actually, Rachel, we will need to go to the provider. I think it's the federation, local federation. That I can't see them refusing, because I just don't think they've thought about it. They've been so busy, but I'm sure they would. Yeah, they can offer that out. We'll take that back, Rachel.
I think that's a helpful suggestion. So we'll see if perhaps we can do those specialist days in all the boroughs so that everybody's had the chance to go to one, if that's how they would prefer to get their vaccine. So we'll see what we can do about that. Okay, so I'm not seeing any other questions in the chat. So if anyone's got any last minute questions or comments, if you could put them into the Q&A now. We have got 10 minutes left, but I know that we've talked about a lot. So unless anybody's got any burning questions. No, so we can't see anything, in which case I think we'll bring this to a close. So I don't know if the panel have any closing comments or any last remarks you want to make.
Just to say that actually, if there are people that are still thinking, please try and get some help from your the learning disability nurses or your GP, and all, as I said, your the social prescriber link workers for any information that you need to help make your decision. There is also help available via Rizwana's team to try and vaccinate people that require a bit more help. So there's lots of help there. It's just you just asking for it. That's it.
Lovely, thank you very much. So I'd like to thank Dr. Sood and Rizwana for their time today. I think that's been really, really helpful. And I think, like we said earlier, sometimes having all the information written down isn't always as helpful as seeing somebody talking it through and explaining it. So thank you very much to both of them for their time today to talk through some of the questions that we've received. I hope everybody on the call has found it helpful. I hope that those of you who were not sure about it may feel a bit better about some of the questions that you've had, and I would echo what Dr. Sood has said as well, that if anybody is still thinking about it but does need a bit of extra help, please do speak to your GP, your community learning disability team, your social workers, to make sure that you get the support that you do need. And if anybody, like I said earlier, has any specific questions about perhaps themselves or somebody they support that they didn't want to ask today, our email address is at the top of the chat there, so please do feel to send us a direct question and myself or one of the panel members will pick that up and answer. So with that, I will close. We will send around the slides to a link to where we're going to publish the slides and the easy read information and our question and answer document. If you do know anybody that couldn't make it today, please do feel free to share that with them so that they can see. And the recording of this session today will also be shared to everybody. So we're going to record it and upload it so that if people haven't been able to make it today, they will be able to watch it back. So hopefully that will be useful for more people as well. So with that, then I'm going to close. Thank you very much, everybody, for joining us this afternoon, and I hope you have a lovely evening. Goodbye.